All right. Welcome back to the Subconscious Healers podcast. I'm Dr. Gabe Roberts, and my wife, Dr. Tiffany Roberts, is here as we're discussing all things mind and body. And what we're doing is kind of a continuation from last podcast where we were talking about some concepts that have been um, they've been brought up to us. People have been curious about it. They've been asked about, you know, a large majority of cases out there are actually misdiagnosed. Um, and let's face it, whenever a person gets a diagnosis from a doctor, yes, there may be short-term relief because now you have an answer for what is causing your symptoms. You know, if it's neuralgia or rheumatism or, irritable bowel or what are some other conditions, huh? Neuropathy, tension headaches, migraines, chronic back pain, shoulder pain, things like that. Um, Whenever people are suffering, they want some answers. And the diagnosis that a doctor gives them a diagnosis, right? It gives them an answer, a name for something. And they momentarily go, oh, thank goodness, now I know what's wrong. But that is a very short term because a majority of diagnoses from all standards are idiopathic, which means they're not really sure what causes it, but we're going to give you this label anyway, and treatments will be offered. And the relief I said is short term because they're not really resolving the issue, because there's a good chance that their label they've given you is not addressing the root cause. So that's kind of what we're addressing in this. That's what we're talking about, the root cause of majority of these illnesses. And I can tell you time and time again that it's been studied, it's been verified. I continue to collaborate with professionals that see this. A majority of the cases out there, when I say a majority, 85, 90% of people that have chronic symptoms are rooted in childhood trauma and stressful life events that have a continuation in their life, and keeps their brain in a threat response mode. And no doubt about it, when the brain is in a threat response, it will create symptoms, and it will basically diminish, if not completely stop, the body's capacity to heal.
So, yeah, we were talking about all these different conditions. I even have a friend that recently started developing issues where she's having blood issues. She's passing out for no reason. She's really weak, and she's gone through all the tests, all the blood tests, all the MRIs, um, every kind of clinical evaluation that you can come up with, and they can't find anything wrong with her. They told her that it is a clinical incident. And basically, that's a hyped up term for idiopathic, which means they don't know what's wrong with you. So there's nothing wrong with you.
They said a clinical incident.
Yep. It's a
Okay.
clinical incident. And that usually means they don't have answers. So, and they told her, oh, we'll just follow back in, 6 months to a year and we'll see how you're doing. Well, obviously that doesn't give her answers. And I, discussed with her, do you think that it's because of a certain situation in life that occurred during this time that caused high stress? And she's starting to realize that yes, it probably was that. So that's just another incident where you go through all the clinical things and oh, there's nothing wrong with you.
Right. And that happens with the majority of both allopathic and even functional medicine, because although they have a little bit more range of markers and things they can look at for testing, um, and they'll, offer treatments with supplements and nutrition and things like that. Their methodology for really changing the person's awareness, changing their stress response, changing how they feel about themselves, how they feel about life is very minimal. Okay. So yeah, so your friend, and I'm aware of this friend as well, and she has a lot of stressful things going on with her home life. And she is very much entrained in the old
Western.
school model. Yeah, the
Yeah.
the Western, okay, to where um they operate off the premises that they separate, I'll just say this, they separate the mind from the body. They're looking at things like the physical body and they're trying to treat it and they're running blood work and they're, even doing, I think she had a CT or something or an MRI or
She's had
something.
CT, she's had
Right.
MRI.
So um again, missing it because they're looking for some kind of physical causation. And in this case, stressors and mental turmoil and a subconscious mind in distress and a brain in threat response. There's no testing really for this. They don't have any way of evaluating that, other than maybe some cortisol, but that's really not going to um, define the picture as clear as it needs to be. So we both know that her stress is off the chart. So
Right. Another thing that could be like a chronic psychosomatic is grinding of the teeth, especially when you're under stress and you've gone to the dentist and you've done all the mouth guards and all this stuff, or you've had an adjustment for your TMJ or your Atlas, but you're still grinding your teeth. And I know a lot of people say, oh, it's parasites. You need to do a parasite cleanse, but it still stays there after a parasite cleanse. That's a psychosomatic.
right. So mind body, okay. Psychosomatic is mind body. Um, TMJ challenges, tympanic mandibular jaw issues, basically are more than likely repressed anger. And you and I both know from clinical practice that we've worked with people and we've done parasite cleanses for grinding teeth, and there may or may not be resolution with that. Um, I did an interesting interview with Robin, okay, and on a podcast, and she pointed out some things because she has researched this. She says that parasites are in fact beneficial. Now, this aligns with what Dr. Zachary Bush, probably the most intelligent doctor, one of the most intelligent doctors on the planet right now, Dr. Zach Bush. This aligns with what he says, that these are in fact beneficial microorganisms, and they act as kind of the garbage man. They help us dispose of things. They help us clean things out. Parasites aren't there if you have healthy tissue. They are, and I'm going to say that even further, parasites aren't there if you have harmony in your mind and your subconscious and you have boundary controls. When a person has um, chronic issues with parasites, you can take all the cleanses you want, all the herbs, the wormwood, the garlic, uh, Mimosa pudica, all the enzymes and everything else to eliminate these, and they will return like clockwork. And this is this is a well-known phenomenon in functional medicine. They get rid of them, they come back. They get rid of them, they come back. And it's not because the stuff doesn't work, it's because they're doing symptom work. They're working on symptoms when a person is, in fact, there's many different ways of describing this, but I'll just say it at the most fundamental, um, the fundamental aspect of this is that that person is in some way in harmony with those microbes. There's a good chance that they are um, not saying no to somebody. They are having poor boundary, um, they're having poor boundary control. They are, I'm going to glance through this right here. I don't see her work as not being correct in some way. I'm just going to look at this reference for this because we're talking about it. Um, this is, in fact, I'm looking up Louise Hay's thought cause alignments for parasites. The one I see is boundary control. People, you can't say no when you should say no to people, and you allow people to take your power away and um, do things that you know you should be defending yourself from, but you don't. That is letting people uh, pass your boundaries. And if you extend the metaphor, then you can see why parasites come into your life. And right here in her book, Heal Your Body, uh, parasites giving power to others, letting them take over. Okay. A brain and threat response, a person who feels undeserving, a person that um, can't say no when they should, is a person that will be attracting parasites regardless of how many cleanses you do. And that's just one component of what can cause grinding of teeth. Because if they're letting people cross their boundaries, they are in fact repressing some emotions. They are going to be repressing feelings that they should be expressing, but for a fear of what other people think, disappointing others, the repercussions of what might happen. Um, Sometimes these people have had their own, they had a boundary violation at one time, they defended themselves, and then the repercussion from that was um, so much that they converted to appeasing, to where they now have very, very poor boundaries. They allow people just to kind of push them. And the reason why is because they have such a fear of reciprocating and protecting their boundaries because of something that may occurred. Now, this can happen with helicopter moms. This can happen with people that are in abusive relationships, things like that. And so, as a result of not expressing their self, as a result of not sticking up for what they know is authentic, um, saying no when they should say no, versus just appeasing to people and being concerned about other people's feelings, they repress their anger, and as a result, they're going to have um, clenching of jaw, grinding of teeth, constant tension, tightness, uh, and TMJ problems.
Yeah, Florence Scovel Shinn even said it back in the day where um and, we kind of moved on to the little parasite thing, but she said that you attract it. Even with food poisoning, someone could eat the same food as you and have a good mental state and not be affected. Yet, if you have the resentment and the poor thoughts and the anger and things like that towards people, you're going to attract the clam or whatever you're eating
The
that
Yeah.
causes you to have the stomach irritation.
Yep, you'll attract the oyster that makes you sick, is what she was kind
Right.
of saying. And how could that possibly be? Well, we have to understand this. We're so indoctrinated and conditioned to look at this world as a physical world, as a world of separation, a world of you were here and I'm here and there's space between us, and we're these physical flesh robots that we get these diagnoses and that answers everything. But the research is very clear that there's a unified field of information that underlies all of this, and that goes beyond the physical things, and all the physical material things in the world in fact originate from this non-physical field. And this physical field is nothing but energy, it's light, and it's frequency, waveform information. So what Florence is saying is, if you get sick, if you have a microbe make you ill, okay, you are in harmony with that microbe. There's something about you that has a resonant frequency, resonance. So if I took two tuning forks, and one of them is 42 hertz and one of them is 38 hertz, and I ring the 42 hertz one, the 38 one's not going to do anything. If I bring up a 25 hertz and ring it, nothing's going to happen either. But if I bring up another 34 hertz and they're matching, and I hit this one with a mallet, well, the other one automatically starts vibrating. It's the law of resonance. And believe it or not, that gives us just kind of a simple demonstration of this underlying field that connects everything. And whenever a person attract some kind of, whether it's you know, whether it's some kind of food poisoning, whether it's a microbe, a stealth infection, H. pylori, um, a parasite, something like that. It is in fact because there's some level of them in resonance with that. They have some kind of emotional connection to something that's disharmonic in the past. And you mentioned resentment, right? So it could be from a past divorce, that happened perhaps even decades ago. It could be from being abused as a child. It could be from um, somebody bullying them. It could be from uh, a bankruptcy. It could be from a number of things. But we are in fact emotionally connected, energetically connected to various things in our past that have this resonance to us, have this resonant frequency. And if we don't do a good job of clearing and resolving those things, they are in fact going to show up as messengers in life, including food poisoning, relationships, um, uh, uh, people doing things to us, certain circumstances. And like another mentor I love is Neville Goddard. He says that whenever it's not something in your exterior world that's happening, it's merely a reflection of what's going on the inside. And you have to look at it that way. Otherwise, um, you're going to be stuck and continuously retracting. I'm sorry, you're going to continuously be attracting these things in your life as a way to get your attention that something deeper needs to be investigated.
And I want to bring up a point here where parasite cleanses are a good thing in the fact that the herbs themselves have a frequency and they are trying to raise your frequency so that the body will reject the overridden parasite. However, if you are not like working on your inner baggage emotionally during that time, you will regain those parasites again because you are going to go back into frequency with those parasites. That herb is supposed to temporarily help raise your frequency so that you can get rid of the emotional baggage so that you remain at that frequency that does not attract the parasite. Does that make sense?
Right. There's a tremendous amount of information going on out there about people talking about um, parasites are the root cause of this and that and this and that, and they are completely neglecting the thought causal line. They're not addressing the quantum field enough. Now they may say they are because of the testing that they're doing, the muscle testing and whatnot, but that's just kind of an adjunct, a binary way of saying yes or no, a binary way of getting a response for some kind of answer, but it's not interacting with that client enough. That client is not, in fact, changing their internal mental state that is going to either um, make them immune or make them susceptible to those microbes. So, um, the basically the answer to getting rid of parasites is not just continuously taking cleanses, but is in fact changing your mental state where you become more harmonious, you become more aligned with that unified field of divine, loving, creative, harmonious energy. And when you're that way, you're simply not going to attract them. And this is the big reason why not everyone gets those. Not everyone exposed to microbes doesn't get sick. Only certain people do. And, we can put a tremendous amount of theories on that, different theories that come about, but the main cause is a person's internal mental state, no doubt.
So let's move on to maybe insomnia, especially when you are laying in bed at night with the racing thoughts and more emotional worries. Um, this can also be a mind-body issue.
Right. Mind body issue. Insomnia is usually rooted in some kind of guilt It can also be circadian rhythms that are disrupted. And a really good way of just a simple way of helping yourself do that is getting early sunshine, maybe the earliest 30 minutes when the sun is just kind of coming up and you're starting to see it go from dark to light outside, allowing your eyes to be exposed to those earliest frequencies. Um, Give your brain the necessary neurotransmitters, the necessary circadian reset to allow yourself to um, allow your brain to start to reconstruct the chemistry, including melatonin, that's necessary for good sleeping. Because and this means no contact lenses, no glasses, nothing. Just allow your eyes to get um, exposed to that. Now, that's a simple exercise that people can do. That's very effective. But a lot of times, insomnia is there because the brain is in threat response, and the person is um, continuously thinking and dwelling and worrying about certain events that have occurred, that the more they think about it, the more it becomes wired in the brain. And when this occurs, um, the person is unable to, uh, you know, have that peace, that quiet, that 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 time when it starts getting dark, allowing themselves to actually obtain that restful state because their brain is just so wired to be in worry, constant fretting, constant, basically threat response. So, and again, you can, if this stuff is learned, which a lot of it is, you can simply unlearn it.
I know you've talked a lot about before where the body really only knows how to heal themselves. And if you have like an injury or something that has occurred, your body is really done healing that injury at 12 weeks. So, for instance, if you hurt your knee, after 12 weeks, the body is healed. And your knee is still hurting. There's a holographic resonance there. It's not the body being defective, right? That's a psychosomatic issue as well.
Right. One more thing about insomnia before we move on to that. Um, Many times the root cause of insomnia is fear and a just not trusting life. So whenever a person has fear and they continuously live in that fear, their brain continuously reinforces those emotions and gets wired and wired stronger and stronger and stronger because so the fear response becomes so overactive that uh, it- they're just not able to they're not able to trust, they're not able to relax, and they become very hypervigilant to where their brain stays active during the night. Now, you're talking about, and this is a myth that should be addressed, old injuries don't cause pain. And many times in the chiropractic field, physical therapy, um, we hear these things. Orthopedic doctors say the same thing, that it's an old injury, there's scar tissue, something's going on. And it's a myth that old injuries cause pain because after 12 weeks, the body has healed. Okay. That wound, that muscle, the nerve, the bone, cartilage, whatever it is fully healed. Now, if there's still pain going on, it means that the threat response is still active in the brain because the brain is what produces symptoms. Now, there's a couple of different ways this occurs. You mentioned holographic residue, or a holographic field is still active. Well, whenever we have an overwhelming injury take place, our our nervous system takes a snapshot of that. This is how traumas occur, overwhelming experiences occur. Your body takes a snapshot of everything, and it does it through the visual senses. So visual, auditory, kinesthetic, feeling, olfactory, smell, gustatory, taste. There's nothing you encode in your life that's not through this system. That's why you can smell an apple pie and think of your grandmother's kitchen. You can hear a song and go back to prom. You know, go back to prom night or a moment you had in high school years ago. So your body is able to take snapshots, and these become memories within the subconscious mind, and they are stored mathematically in a holographic construct. So this means that there's uh, very precise information stored, and if one little fragment of that is triggered, stimulated from something external, like you smell something and it brings it back, or if you taste something, or if you just if you see food and it triggers your brain to something that made you sick before, that's just a number of ways these things can go active again and get triggered. But once that hologram gets triggered, all the symptoms come back and your brain goes into the same state as if as it the same state that matches the moment when you actually encoded it. So whenever something is triggered, it can cause the pain to come back. That's the software aspect. That's the instructions going on to the nervous system. Um, Example. Now, the other example is hardware, and that's where pain, chronic pain, actually, and this is kind of fascinating. And whenever I tell doctors this, they're surprised. Whenever a person has chronic pain that's gone on longer than 12 weeks, it's because that pain has become wired in the brain. It's like a fire alarm has stayed on long after the injury is over. And now what happens is the brain doesn't wire that pain to the actual pain centers within the brain. It actually wires them to the memory and learning aspects of the brain. So what that means is chronic pain is something the brain has learned to do. It's not something that, and people, it's very, very difficult for people to understand and grasp that. Even our friend that was over the weekend, he had a knee replacement. I said, "Hey, how's the knee doing?" He goes, "Oh, it's strong. It feels good. Every once in a while, it's sore." And he had that knee surgery almost like a year ago, right? So that, or over a year ago. So that physical injury from the knee replacement is healed. But every once in a while, it's sore. And why would that happen? Well, for one of these two reasons. Either some kind of experience, memory that his subconscious had recorded whenever that he was getting the knee surgery done, or anytime he's ever done something to hurt that knee in the past, because his knee was really bothering him before he had that surgery, right? So he had been an athlete, he had been in the military, he had done a lot of things to really trash that knee, and he had that surgery done. So there's a lot of software and hardware involved in that chronic pain. So just because he gets the surgery done does not mean that holographic imprint and the neuroplastic nerve tracks in his brain have actually been resolved. It does not mean that they suddenly just go, "Oh, hey, the knees, we had surgery, everything's good." It means that those still are there. Those brain circuits are still wired for memory that's been associated with learned pain. And every once in a while they can go active and the knee pain returns long after the body is physically healed. Okay. Because he had a successful knee surgery. Everything was good. But the brain, as they say, the body keeps the score. Every once in a while, his brain will go active and those pain circuits turn on and the knee pain returns. And it has nothing to do with his actual physical knee. It has to do with his brain. Um, it has to do with his brain memory reactivating that. Now, let me explain this another way that may be easier for people to learn. There's a doctor that I read about who lives in Australia, and he's a well-known pain neurologist, and he grew up in the woods. He grew up in Australia, out there in the brush and moving around in wildlife. And as he did that for years, he would go out and obtain nicks and scratches on his legs and stuff, going out with shorts and getting caught on thorn bushes and stuff. And he would come home, and he did this as a young boy. And his mom would always notice he had these scratches, and she would, notice that and take care of him, you know, use some medicine or ointments or something that kind of soothe and help them heal. And so he's been associated with doing this. And he continued to do it throughout his life. And one day I think he's younger than 20 years old, maybe 17 or 18. He's out doing the same thing, moving along in the wildlife in the brush. He uh, catches something on the side of his leg that he assumed was like a thorn bush, and he just assumed it was a thorn bush, kept moving until he got home and he noticed that there was actually two fang marks on his leg that he had been bitten by a snake. The minute he realized that, his leg swelled up because it was a venomous snake that bit him, and he spent 3 days in the hospital, um, getting anti-venom, getting the necessary treatments that he needed for healing. So his leg swelled up. He spent time in the hospital. He had a full recovery. After he was recovered, he again, because he's been doing this his whole life, he started going out in wildlife again, going out and in the brush, going out experiencing the woods and things like that. And what's fascinating is he was in a park and he came across a thorn bush or some kind of sharp brush that swiped his leg and cut it. And when it cut it, he knows that it was a thorn bush. He actually witnessed this. But as that thorn bush hit his leg and made a slice into his skin, a snag or a cut into his skin, the memory of everything that occurred following that snake bite, the hospital stay, getting noticing the fang marks, actually made his leg instantly swell up again, twice the size of normal, and him grimace in pain. And it had nothing to do with any venom of a snake bite. It all had to do with the brain circuits of the brain going active, the neurology going active, and possibly that software of that holographic imprint being triggered and bringing his body back to that same state as if the snake bite had occurred when actually it was from brush. So this gives an idea of how fascinating memory on both a software and a hardware aspect can it usually is heavily involved in the root causes of why people have chronic symptoms. And both of these things I'm talking about are not addressed. We're simply using methods to treat the symptoms, whether it's chiropractic, whether it's acupuncture, whether it's medications, whether it's supplements, whatever we're doing, we're treating the symptoms, trying to resolve some of that discomfort, that pain, without even looking at the ways that the body has encoded that on both a holographic and a neurological standpoint. And if we're going to have permanent resolution in these kind of chronic symptoms, we have to address those properly.
So let's see. Mystery symptoms. We just discussed that about my friend earlier, where there was a mystery symptom. Um, that can be a psychosomatic issue. Um, Heart palpitations and dizziness, especially when you're anxious or under kind of an emotional overwhelm. This can be a mind body issue.
Right. Chances are, there's a tremendous amount of mind-body issues that are still missed. And the reason why is because there's not a lot of people that want to address their emotions properly. So let's just face it, there is a lot of people out there that are facing mystery symptoms of all kinds that are taking a suitcase of supplements, or they're, uh, you know, continuously using medications, um, without any kind of real resolution to what's going on. Whenever a person is in that situation, that cycle, um, it is more than likely mind body. And what's going on with that person individually is chances are they're very frustrated that nothing's working. They're frustrated about the investment they've spent, whether it's money and time and effort and everything else, doing what they're supposed to do, and nothing seems to be working. Um, they're having fears of being stuck like that forever, of having these symptoms remain forever or get worse. They're feeling disconnected. Suddenly they couldn't do the things they've always wanted to do, the things in their family, that was a part of their life that now is they're having a loss of that. And that sets in um, a deep pattern of emotions of missing out, feeling no good, feeling like they're letting the family down, feeling like they're not being the father or the spouse that they used to be, they wanted to be because the symptoms are now interfering. And all of these, as well as several others that I could name off, continuously fuel that cycle of the mind body getting worse. They fuel the brain staying in that threat response. They fuel the brain teaching the brain, wiring in the brain, reinforcing to the brain that their body is in fact broken, that something is indeed wrong, and they don't have a way out. Their hope begins to get squashed. And oftentimes, I will say this, the more allopathic doctors a person sees, the more their hope is completely squashed and diminished based on what the doctors tell them. Um, Dizziness can be a sign of, uh, same kind of thing. Scattered thinking, a refusal to acknowledge what's there, if you a refusal to really look at what you need to look at, denial that can cause people to have dizziness. Okay, there's many causes for that, um, but we've seen people resolve dizziness by understanding that, teaching their brain to actually turn the threat response off, teaching them to begin not caring about their symptoms. Man, that's one of the most powerful things a person can do is begin to become indifferent with their symptoms, like they just don't care, like they just don't care. And that's a radically different approach than what people are most to than people are used to hearing or even recognizing. But you have to understand it's from the aspect of teaching the brain to turn those threat responses off. The more focused and the more engulfed you are by those symptoms, the more you're teaching the brain that something is definitely wrong. The more you can slowly step back and with any difference, like you don't even care about the symptoms anymore. They're there. Who cares? Your brain actually will catch on and it'll start to not care about them as much either. And you'll notice that those things start to diminish and the circuitry that's involved starts to weaken. And you can actually start to wire in different circuitry of your brain, like you don't care. Your brain will actually start to wire in circuitry of indifference. It doesn't care. Everything's okay. It doesn't matter. Whatever the symptoms are, it doesn't matter. And when your brain starts to feel that way, when it starts to interpret that and assign those kind of meanings to it, those symptoms diminish and eventually they'll turn off.
Right. So this one, I was debating on whether or not to give like a personal testimony on this, but perhaps it may help somebody. Holding tension in certain areas of the body, whether that's your stomach, your shoulders, your low back, your neck, whatever that is, especially when you're under stress. Um, for me, I was holding tension while I was eating. So like I don't know if you remember this,
Oh,
but
yes. Yeah.
like I would just be tense, like my muscles were so tight as we're eating dinner. I'm sitting here having conversations with everybody and not really realizing it. Um, but going through the work that we do, I noticed, you know what? I'm very tense when I eat. And that means my body is trying to protect me from something. So that is not going to digest the food properly, right? And we talked about in the previous episode, my previous marriage. Well, going through the work that we do, I remember during that time that if I were to gain a pound or two, there was a fear of whether or not he would cheat on me because I gained weight. It was very like the weight was very um, strict in that household. So being able to go through and release those bonds, I'm able to actually enjoy a meal relaxed. So if there's some tension, maybe you get a headache when you go to work, or you just get a certain stomach ache when you're around someone. This is something that should be addressed with, you know, the psychosomatic.
Right, that psychosomatic component. And that's exactly right. What you're saying is that the past marriage, your brain learned to associate eating with danger.
Yeah.
And so as a result, years later, decades later, as we're eating together, there was tension.
Yep.
Tension around food, tension around eating, tension around, being in the kitchen, tension around all that. Anything your brain would interpret, it would associate danger. Now, here's the thing, tension. When we say the word tension, I can give a good example of this. I was working with a client on Zoom once, and she's sitting here in her living room on Zoom with me in front, and suddenly she sees a stranger looking in her window. And it's not really a stranger, it was someone who was hired to come out and look at their septic pump, I believe. And he was looking in the window, maybe trying to get her attention about something because he had a question. So he came up, knocked on the door. She didn't hear it. So he's looking in the window. And the minute she sees this stranger, this man looking in her window, her whole body goes tense, or like her, fists go up like she's ready to fight. That's that's the brain's natural response to a threat is tension. Okay? Remember that. Let me say that again. The brain's natural response to a threat creates tension in the body over and over. Now that threat can be from certain emotions you're not allowed to express. That that threat can be from linking something together either appropriately or inappropriately, such as if I gain a pound, my husband's going to cheat or leave me or not be attracted to me. All of that is a threat response to the brain. So what we have to do for our listeners, anyone listening to this, is understand that when you feel that there's tension going on in your back and your neck and your shoulders, in your stomach, in your bladder, okay, in your pelvic area, tension going on in your heart, tension going on in your chest, tension going on somewhere in your body that you're able to have an awareness of. Explore what you're doing, have an awareness of what's going on, and there's a significant chance, high correlation that your brain is in fact interpreting something as dangerous, and it's probably not at an appropriate time. Okay, like in this case for this woman, that was an appropriate time. A stranger's looking in her window. Her body gets tense. But if we're sitting here talking, or if you're sitting there eating, or if you're driving a car down the road, and it's a nice straight road and it's relaxing and you're wide awake, it's not really a threatening, it's not really a threatening ordeal. If you're taking a nice walk somewhere, if you are anticipating doing something with your family, a vacation or going out to the beach for the day, look at all those things and look how your body responds. And if there's tightness, tension, discomfort somewhere, there's a really good chance that your brain has correlated something to a threat response. And the problem is that will only get stronger over time. So it is something that needs to be recognized, and needs to be basically unlearned.
Mhm. One probably last thing that we'll probably discuss today is probably a big one, especially for women. And I too dealt with this myself, was the disconnection from our body. Maybe we feel numb. Maybe we don't feel feelings. Um, in my case, it's because I had to bury all those feelings because it's easier to protect myself than to be able to speak what is on my mind. And that creates a disconnection between your body and your spirit, and you're not able to deal with emotions. You're not able to deal with memories that need to be dealt with. And so when we first started our work, it was very difficult for me to feel where feel where I feel it in the body and find it out in space, right? It was very difficult. Um, but the more that we do this now, like I couldn't even feel gratitude. Like there was no happiness, no joy, no anger. It was just constant streamline, right? Now I'm able to feel states of joy and gratitude, the way that God is supposed to work through us. So I'm just saying that any woman or even a man, it's more common in women. If you feel that disconnection, that numbness, and it's difficult to really work on those emotions, I'm just saying keep at it, because this is something that is highly, highly important, especially if you want to get connected more with divine. Um, and
Right.
and also I want to remind everyone that in October we're going to have an in-person event where we're going to be working on all of this and diving deep and having amazing breakthroughs during this 3-day event. And I highly recommend that, if you have just an inkling of could this be me, I highly recommend you come because it will be completely life changing.
Absolutely. We're going to be going into the depths of this even more, and essentially breaking out all the tools we need to have people get free of their pain, get free of their chronic suffering. So it'll be an event definitely worth being at.
Right. So I'll put the link below. And also, if you're interested in maybe taking a quiz to see whether or not you are experiencing the psychosomatic pain disorder, we have a free quiz and also a free video to go, more in depth on whether this could be something that you're experiencing. And I'll put that link below as well.
Excellent.
All right. Thanks everyone for joining us today, and we'll see you next time.